మధ్యలో వస్తున్నా మొత్తం.
Being all of us in the medical profession, it's our moral duty, more than a common man, to identify malignancy at an early stage so that we can do some remedial measures, we can prevent it. There are, as you all know, that there is a role of prevention for malignancy, and if that is not possible at a later stage when it is diagnosed, we have to treat them. But we all know that treating malignancy is not a simple thing, and it will cause a lot of disability and derivation for the patient. So the most important one is prevention. And today, the theme which is taken here, the oral malignancy, which constitutes almost third of all the malignancies in India. That itself is an indication. The amount of cases every year we are detecting oral malignancies is mainly the most significant cause of oral malignancy is the tobacco and the tobacco products. In spite of the government banning these tobacco products, still they come into the market and they are causing such severe damage to the individuals, especially things like gutka and ingredients of pan masala like areca nut, which can provoke changes in the oral mucosa and cause malignancy at a later stage. So it's a very significant thing. This day is something like we are trying to convey to the society what are the preventive measures which you can take so that you can not fall into the trap of developing malignancies, whether it's an oral malignancy or malignancy anywhere in the body. Where nearly 8.8 million patients die every year all over the world, then we can realize the importance of preventing malignancy. Today, slowly I think down the lane in next few years, the cardiac problems and other diseases, cause of death with those will be comparatively less than the malignant cases. So today this walk, which is organized by the dental college, government dental college in Hyderabad, will signify this particular cause of preventing malignancies, and with the main theme of preventing oral malignancies in the population, and try to avoid taking those products which can induce malignant changes in the body, especially the oral cavity. Thank you.
Thank you, sir, for your precious words. Now I would like to thank our radio partner, Big F, to give away a few words.
My colleagues, Dr. Venkateshwarlu, Dr. Jagdish, Dr. Venkatamana, other staff members, students, postgraduates, interns, especially 2K, 13 batch of interns. Electronic and print media. Thank you very much for supporting the what our students want to give the public awareness on the occasion of World Cancer Day, that is on 4th February. Every year will be celebrated. The main aim of organizing this event is the society should be benefited and educated the society so that the oral cancer, particularly in general cancer in all any part of the body, can be prevented by educating the people. By taking the initiation, our students have taken the initiation to organize this program in the public place. Otherwise, the same thing we would have started in our college, but the more awareness can be created in the public places like the Necklace Road and Purple Plaza, so that people can see what the role of the doctors doing the social cause. For today, especially oral cancer awareness, we like to give because as the dental surgeons, the first person who examine the patient is the oral cancer. The early detection, the oral cancer can be cured. Nearly 30 to 50% of patients' cancer cases can be prevented if diagnosed pre-cancerous conditions like leukoplegia, lichen planus, oral submucopurposis, other pre-cancerous conditions, so that these conditions can be turned into the malignant. So we can have the big goal as the dental surgeons to check any patient come to us, give the proper education to the patients for the pre-malignant condition which lead to going to be cancer. Like so what the sir said, the tobacco products, all of you know tobacco products are the main causative factor for the oral pre-malignant conditions. It will lead to the malignant condition like pan parak, pan masala, gutka, pan, various ingredients which contains arak, that is the tobacco, and arak, that is called the chupari. These are the main ingredients which can cause the pre-cancerous condition, which can turn into the malignant condition. So nearly in all over the world, around 30 to 40 lakhs people, the oral cancer, suffering with oral cancer. In India alone, nearly about 10 lakhs people oral cancer, people will be suffering from the oral cancer. So this is a big number. This is our responsibility as the dental surgeons, as the students from the resident Government Dental College and Hospital Hyderabad, taken the very early initiative and they're very sportive, and this class wanted to organize this program in a grand way. I'd like to thank the chief guest of today's event, Dr. Ramesh Reddy Garu, Director of Medication, giving the time and spending the time and encouraging our youth, our students to such activities in future. Thank you very much, sir, for coming and getting this occasion. Thank you one and all. Thank you for all the electronic and print media. Thank you.